I'm Martin James and I'm the Clinical Director of SNAP. And this is just a brief opportunity for us to look forward to what SNAP's got coming up over the next 6 to 12 months or so. So just in this presentation, we're going to look at three things. Firstly, what's been going on with SNAP over the last 6 months. It's been a busy time for the NHS, of course. What we've got planned for the next 6 months, and then importantly, what you can do to prepare your participation and get involved. So what's SNAP been up to over the last 6 months? Well, it's been a very busy time, probably busier than we would normally be. Of course, we've been continuing with our quarterly reporting outputs, and there are 3 to the calendar year so far. But of course, all of those quarters have been affected by COVID. So we've just been doing site level reports for these, and you haven't been receiving the aggregated regional or national color coded charts that you're so familiar with. And that's of course because of the impact on acute services from COVID. But we have also been providing monthly national COVID reports, and those are available on the website. And we've collated our COVID information into a webinar that's called An Insight into Stroke Care During COVID-19, at least the first wave of COVID-19. And that's also available on our website if you're interested to look at that. We have, of course, been collating all the results into our annual results portfolio. And now, of course, we've got 7 consecutive years of SNAP data presented side by side so that you can compare how your team has been progressing over the last 7 years. And a lot of that has been collated into our annual report, our 7th. This is titled Springboard for Progress. And basically it's describing the baseline position before we hope to see much more progress with quality improvement for stroke over the coming years, stimulated by the long-term plan. And we've got a webinar about the annual report. The report itself won't be published until early next year, but we have a webinar at 3:30 on the 9th of December, presented by our very own AJ Bala, Associate Clinical Director at SNAP. And so if you'd like to register for that webinar, do please contact the SNAP Help Desk on that email. And then what's coming up over the next 6 months? Well, a lot is the short answer. First of all, you'll probably be aware that there are going to be additional data collection items stimulated by the long-term plan, some changes to the core data set, including additional thrombectomy data, and also for the first time, the opportunity to start a record in the community. Then we've got 2 organisational audits coming up in 2021. First of all, in March, a post-acute organisational audit trying to capture all the structure and provision of care for people after they leave hospital. And then in July, our next iteration of our biannual acute organisational audit. We're also planning to increase the frequency of our reporting so that teams have more access to real-time data. And as increasing early targets come in for the critical time standards, we're going to be beginning monthly interim reporting of data from the first 72 hours. A big change is the introduction of the National Data Opt-out. This becomes active from the 31st of March 2021 and involves teams doing mandatory checking before locking or validating any data in the SNAP web tool, or indeed checking before transferring the record. There's more information about the National Data Opt-out available at that web address. And we're going to be working with teams to overcome this new issue, and it's going to be made an awful lot simpler for teams if they increase the proportion of consent that they use. And so we'll be providing user groups and support teams about the National Data Opt-out. And then, of course, in England, with the introduction of the 20 integrated stroke delivery networks, we'll be slicing the national data at ISDN level to stimulate data-driven quality improvement at a local level. So if the question in your mind is, what can I do to prepare for these upcoming changes over the coming months? There's a lot that you could do. Firstly, if you're in an acute team, then we'd encourage you to if you don't know already, to identify and engage with your post-acute teams within your ISDN and particularly within your own local care pathway to ensure that they're getting registered and involved with SNAP if they're not already, and of course to ensure that the pathway of care for your patients is tracked all the way out to 6 months. Secondly, if you're in a post-acute team, and particularly if you're a post-acute team who hasn't previously been involved with SNAP, and we know that there are many out there, then we'd be encouraging you to register and begin now the process of engaging with SNAP, particularly as a prelude to the post-acute organisational audit that will be done in March. Thirdly, and I've mentioned this already, you need to be looking at the information that's available about the national data opt-out and consent, and you need to decide what your approach is going to be to this new legally mandated issue, and in particular how you might go about training your staff and revising your processes to increase the proportion of people who explicitly consent for their data to be entered into SNAP, because that gets round the need for you to do any kind of checking against the national data opt-out lists held by NHS England. And then fourthly, with all this coming on, we'd encourage you to access SNAP webinars, news groups for both acute and post-acute teams. We are setting these up over the coming months, and there will be plenty of opportunities both nationally and regionally for you to register for SNAP, engage in local user groups, and of course to hear about how other teams are coping with uploading data to SNAP and issues like consent. And also, as a prelude to what's going to be an increasing level of measurement of therapy participation in the community, you can start practicing your methods for recording therapy in the community. Acute teams may well need to be revising their processes so that their monthly uploads are up to date and their monthly interim reports are therefore valid and meaningful for quality improvement. And for all teams, we'd encourage you to keep an eye out for the 2019 to 20 annual report, Springboard for Progress, when it is published early next year, because that's an opportunity for you to circulate and publicise quality improvement effort in stroke, send it to your chief executive, send it to your clinical effectiveness committee, discuss it with your local clinicians about how to stimulate further quality improvement. And then, of course, submit your quality improvement stories to us on the website, and then you may find yourself featuring in next year's annual report. So thank you very much for listening, and we look forward, of course, very much to working with teams in the months to come as we learn more and more about what SNAP can tell us to improve the quality of care that we deliver to every patient with stroke all the way along the pathway.